During times like we're going through right now, it can be difficult to stay positive. And this morning, Dr. Shoba joins us to discuss how positive thinking and making meaningful connections is definitely beneficial to our heart health. Good morning, Dr. Shoba.
Good morning.
Let's talk about this. I mean, it is kind of difficult to stay positive when you're hearing so many negative things in the news and things.
That's right. And even if you have something good going on in your family, it is so hard to enjoy it to the fullest because of all the negativity going on, and difficult for people to enjoy togetherness and meaningful connections in these times.
When you're talking with your patients about positive thinking, do you give them tips? Do you tell them, you know, accentuate the positive? It's the old song standard, but it's a lot of truth there.
That is true, and it's very difficult to stay positive, but I think each of us needs to find something within ourselves to strengthen ourselves, or find somebody in our loved ones or in our circle of family and friends that can pull us out of these times.
And that goes back to making meaningful connections. It's important. I mean, I know we're socially distanced sometimes, but it's important, even if it's via Skype or Zoom or something like that, to make some connections with folks.
That's right. And you know, when we talk of meaningful connections, let me give you a little example. My son came and talked to me yesterday. He was just standing beside me and talking to me, and here I was looking in the computer, answering his questions while looking up some patient test result, you know, I mean, or whatever it is. And he was talking to me, you know, standing on the other side, and I would not even look up at him from my computer. I was, you know, isolated. So was that a meaningful connection with my son? Absolutely not. So if you're talking with your spouse or with your child, are you taking away from your Facebook? Are you taking time away from your internet to look at your spouse or your friend or your child and say, you know what, that 1 second of meaningful connection is so much more important. We are so used to doing this while we are answering questions.
Yes. I think we're in a multitasking world.
Yes.
And sometimes it's time just to push things aside and have a one-on-one with someone.
That is correct. And I tell you what, negative thoughts can cause heart attacks. For example, there is a condition called broken heart syndrome, where somebody gets a big negative news and then they have a massive heart attack, and we may not find any blocked arteries in their heart. So negative thoughts can actually cause massive heart attacks. Depression can prevent people from healing well after open heart surgery. So it is so important to stay positive, because negative hormones, you know, we have those flight and stress hormones, you know, the epinephrine, you know, that takes us over those initial crises. But then it also leads, you know, when you're angry, those hormones can cause high blood pressure. You come home and you're still angry, and you're eating bad foods, junk foods, just to kind of get over it. You know, food as a source of calming you down. You're not exercising, you're not sleeping well, because that anger is keeping you up at night. And so that anger is hurting you. The depression is hurting you. So you need to find a way to be positive, even at work. I mean, just be grateful you have a job. Just remember that your boss is having a hard time. They are as scared about you as getting fired, you know, as you are. I mean, they are having a bad day too. So I think in this world of negativity, you know, we just need to try to find a place to be positive, whether it's at work, whether it's at home.
And I love the fact that you said you were talking about the open heart surgery patient. Do you find that those that come out of surgeries, heart surgeries especially, if they have that positive attitude, they're more upbeat person, do they tend to do better?
Yes, absolutely. They actually tend to heal better, recover better. They have healthier lifestyle choices. And remember, when you're connecting with people on Facebook, if it's just a negative connection that is building up more negativity, you know, more jealousy, more anger, and that is, you know, we want to avoid that. I want you to calm down and think of a person in your life that you can turn to at any point, call at any time and say, I'm having a bad day. You can vent out to them, and they will lead you into positive. That is a true meaningful connection. That is your true friend, because they are going to lead you away from the bad into the good. So think about that one person in your life that will not judge you when you call them.
We all got to have somebody like that.
Yes, we should. We need to build that meaningful connection, that we have that one person in our lives.
Do you think sometimes we should maybe just push back a little bit from the social media and things like that, and just take some time, even if it's just us, some time to just decompress from all of that?
Oh, that is so important. You know, take away from the social media, take yourself away from the internet for a few minutes. Spend some quality time with your family, even if it's just 1 minute, if it's just 1 minute. That eye contact with your child. I so regret that conversation yesterday, but I tell you, I'm going to make it up to my son tonight.
I know you will.
I know. I felt so bad last night when I went to bed, when I realized what I had done. And I said, I'm such a hypocrite. I'm speaking on this today. And I let my son down.
All right. Dr. Shoba, thank you so much. Some great positive thoughts heading into the rest of our week. We appreciate it. Folks, we got some information for you right there. It's the Heart Association, the American Heart Association, doing great work. Remember, keep a little positivity in your life. It'll go a long, long way.